Welcome back. So now we'll be covering the entire respiratory system, and it mainly includes two topics, that is cough, as well as we'll be discussing on the bronchial asthma. So firstly, let's start about cough. So here under cough there are many categories such as pharyngeal demulcents, as well as there is expectorants, and there are antitussives, and there are adjuvant antitussives. So now going to the pharyngeal demulcents. Under pharyngeal demulcents there is lozenges, syrups, glycerine, and licorice. You can write this multiple times and it is going to stick with you. Next, we also have expectorants. Under expectorants we have the secretory enhancers, whatever increases the secretion. Under this there is potassium citrate, potassium iodide, guanfacine, there's tolubalsam, there's wasaka, as well as ammonium chloride. So while giving the examination we need to know each and every drug, and we need to know which category it falls, so it becomes important in that aspect. As we saw, this expectorants has increased secretion. There is another category known as mucolytics. So under this category of mucolytics there is bromhexine, and there's ambroxol, there is acetylcysteine, and there is carbocysteine. So now moving ahead, we will be looking at the other category, that was antitussives. And antitussives, they are further divided into opioids. Under these opioids there is codeine, ethylmorphine, as well as folcodeine. Now moving on to the second category, you have the non-opioids. Under the non-opioids there is noscafine, there is dextromethorphan, and there is promethazine. Now moving on, this is not promethazine, it is fed and all. Now moving ahead to the third category, there is antihistamines. Antihistaminics. Under this, there is chlorpheniramine, diphenhydramine, and there is promethazine. Okay, and last we have another category. This is known as the pulmonary receptor desensitizer. Under this, there is peroxydiazine. Okay, now moving ahead, we'll be looking at another category, that is adjuvant antitussives. Under adjuvant antitussives, there is bronchodilators. So this category includes salbutamol as well as terbutaline. Okay, so we are done with cough. So now let me just give an outline of what we have covered. So basically, cough, the categories are pharyngeal demulcents. Okay, the second one being expectorants. The third category being antitussives, and then we have the fourth category, that is known as adjuvant antitussives. So these are the three. Let me name it 3, and this is 4. So under this, there are several categories like expectorants. There is which increases secretion enhancers, as well as second category which acts as mucolytics. In a similar way, these antitussives are also divided. So here we have a class of opioids antitussives and non-opioids. Next, there is antihistaminics, and last we have the pulmonary receptor desensitizer. Okay, hopefully everything is clear. Now, as we have done with cough, we'll be moving ahead, and after cough we'll be discussing, as told earlier, this will be on the bronchial asthma. I'm writing short as BA. So here there are, again we'll be just going back and looking at the skeleton of what we are going to learn. First one being, under this there is bronchodilators. Second one being, there is leukotriene antagonist. Second. Third, there is muscle stabilizers. Fourth, there is corticosteroids. And the last class is anti-IgE antibody. Let's just read it out again. So we have told bronchodilators, there's leukotriene antagonist, there's mast cell stabilizers, there's corticosteroids, and last we have the anti-IgE antibody. Now, just looking at each one of them, under bronchodilators, there is, let me just write it again, the bronchodilators, we'll be discussing that. Under the bronchodilators, there is beta 2, sympathomimetics. Okay, so this is the first one. And under sympathomimetics, there is salbutamol, there's terbutaline, there's bambuterol, also salmeterol and formoterol. Okay, now moving on to the second. Under this, there is also methylxanthine, under methylxanthine there's theophylline, aminophylline, choline, theophylinate, hydroxyethyl theophylinate, and doxycycline, doxophylline. Theophylline, aminophylline, choline, theophylinate, then hydroxyethyl theophylinate, and then doxyphylline. Next category, there is anticholinergics. Under anticholinergics, there is ipratropium bromide, next there is also tiotropium bromide, okay. Now moving ahead to another class, there is, under the broad heading, there is leukotriene antagonist. Under this, there is montelukast and zafirlukast. Now moving on to another category, there is mast cell stabilizers, writing short as MCS, okay, mast cell stabilizers. Under this, there is sodium chromoglycate as well as ketotifen. Okay, now moving ahead, other class, it is corticosteroids. Corticosteroids, there is systemic and under systemic there is hydrocortisone, prednisolone, and other glucocorticoids. Next, other category under corticosteroids is inhalational. Under this inhalational category, examples include beclo, methasone, dipropionate, budesonide, there's fluticasone, propionate, flunisolide, and cyclosolide. Yes, so you might be wondering how to remember these names. Writing it multiple times will help you memorize it. You can practice writing it once, and maybe after 2 hours you can just come back and write it again. So you need to keep repeating the cycle until you're familiarized with all these words. I have written it multiple times, and that's why I can read it and write it fast. So now that is done with the inhalational corticosteroids, and next, the last is the anti-IgE in this group. Anti-IgE antibody, and under this there is omalizumab. I'll write it again. It is omalizumab. So yes, that's it. Thank you for watching, and I will try to cover the entire chapter and listing all the drugs in that. So today we are done with the respiratory system, and or I may also go ahead with the respiratory tract about the pathology involved in the RS. I guess that will be a better idea to move ahead with. And thank you once again for watching, and if you want to stick around with the videos I put, do subscribe. If you do that, you will be notified about the new videos. Okay, thank you once again.